What's up, everybody? Welcome back to my channel. It's your boy Hillman here. For those of you who are new to the channel, welcome to the club. Be sure to like and subscribe and share all that good stuff if you find the stuff I do interesting. If you don't, it's a free world. For my subscribers, thank you for being so loyal. Welcome back to another video. So as the title reads, I'm going to be talking about what it is like doing the clinical rotations, so the medical clinical rotations in Dutch, as someone whose first or mother tongue is not Dutch. I already made a video about this before. Then I was in the Bachelor, I think that was 2 years ago, talking about how it was for me studying in Dutch as someone who was not a Dutch native speaker. So I'll be sure to link that video somewhere here for those of you who have not seen it. That could maybe give you insights into how the process has been for me, the transition from the Bachelors to the Masters. But in this video, I'd like to zoom in a little bit more on what the Masters, so the clinical rotations, have been like for me. And I think something, for example, something I mentioned in the last video was, you know, some of the challenges that I faced in the Bachelors. Just trying to understand stuff, trying to cope with the presentations, trying to cope with the exams, having to take the exams in Dutch and feeling like I didn't have enough time and all that kind of stuff, which really got to me back then. But then I think, like you would expect as well, things take the natural courses. The more you do something, the better you get at it. So along the way, I've gotten better for sure. I've gotten more comfortable speaking the language, expressing myself in the language. And I think the Masters is just, it really gives you the space to grow with regards to that. So I would like to touch on a few points which I think kind of stand out to me when I was thinking about this video and what to tell you guys about this topic. And the first thing I would like to highlight, I don't know if this is peculiar to Maastricht University, is the fact that in year three really kind of prepares you for the Masters in a lot of ways, but especially with regards to non-native Dutch speakers transitioning to the Masters. And this is something I guess is just for people who do the regular Dutch track, ITM. I'll come back to that later. But I feel like it really, year three, for those of you who don't know, the year three medical year, or the medical curriculum in year three in Maastricht University looks like this more or less. It's just 4 clusters in which you have presentations. So basically, I think it's one time a week. Yeah, it was one time a week. One time a week, you have presentations. There's other practicals. There's other days where you go to the hospital for your kind of sub-clinical rotation, part clinical rotation, or pseudo-clinical rotation, whatever you call it. You go to the hospital, you do practicals and everything, and then once a week you come and it's just a series of presentations, 4-hour-long tutorials, presentations. So you present, and basically after you're done, you have to listen to the rest of the people present. Sometimes could get really boring, but the point I want to zoom in on is the fact that you get to practice and practice and practice. You get to practice presenting, which you have to do in the hospital during your clinical rotations as well, which of course the stakes are high. Everyone knows your stuff there, so it's a little bit more tense. So it's good that you at least have that presentation part on check, so that you don't have to think about that as well. So you get to practice a lot in year three. You get to practice explaining things and answering questions which people have, which is something you're going to do in the hospital with your patients, which is something you're going to do with your colleagues at work when you're presenting stuff and they don't understand or it's not clear to them. I think it's just cool that you get to practice that explanation and the answering questions part. And I think just practicing with an audience, that for me was like, I did not see how it prepared me for clinical rotations, but I think it definitely did. Just giving me that space in year three to practice as much as possible, talk as much as possible, answer questions as much as possible, get picked on as much as possible with regards to the knowledge, getting asked questions with specific things, because sometimes you get bored or you get a little sloppy with preparing the presentations, so it's not as good as you would want it to be. But then being ask questions on specific things just still challenges you to think about it and brainstorm some of the things for yourself. And I think that's really what happens sometimes in the hospital as well during clinical rotation. So I think it's a good preparation leading up to that. So for me, the first one I want to mention is year three felt like a good preparation for me to get into the clinical rotations. The second thing I'd like to mention, which I think is worth mentioning, is the interaction in the hospitals. I think there's a difference between interacting with patients and interacting with your colleagues. Because, for example, I remember when I started medicine, I was like, bro, I don't want to sit in the class and interact with all these Dutch people. They were natives and everything. I felt kind of inferior. I felt inferior in year one, if I'm being honest. So I was like, I just want to get into the hospital where I'm interacting with patients. I don't have to sit in tutorial groups and speak and everything like that. For some reason, I thought it was going to be easier. And in many regards, it actually was. But in many other regards, it wasn't. So interacting with patients, for example, that is considerably better. Because, or at least it comes a little easier, depending on what kind of patient you have. Of course, if you have an angry patient, then everything just goes all over the place. But that has nothing to do with you not being a native speaker. Even a native speaker would have difficulty with that. It's just nerves and the situation and the circumstances. With regards to the language use, patients require you to simplify stuff a lot. Like, you cannot tell a patient or transmit information to a patient the same way you transmit to your colleagues. You cannot use medical jargon to talk to patients because they will not understand stuff. Some patients do, because some patients are highly educated, but not everyone has the same level of education in the Netherlands. So you have to kind of like, dose the information you're giving the patient rightly so they can receive it. And I notice a lot of the patients, depending on which hospital you are in as well, they require you to really simplify your language. And that sometimes feels, for a non-native speaker, a little more comfortable to just be in that space where you're not required to perform at your highest language abilities and everything like that. So I think communicating with the patients, of course, depending on what patient you have in front of you and where you are, what clinical rotation you're doing, that could really make you could feel much more in your field, or you could feel more comfortable compared to if you're doing it with colleagues, on the other hand, who then same level of education or higher, same level of expertise or higher, and everything is just much more, up there. It's just much more complex, intricate, sophisticated. I think that's the right word. So I think it really differs. I personally have noticed, especially because also in clinical rotations, you're not recorded like we had in the bachelors, where you're recorded and it's analyzed afterwards by your classmates. You're not recorded. You have the freedom to be yourself and ask questions. And sometimes, to be honest, I've noticed patients don't really care if you make a few errors. You would think your whole world is collapsing. The patients think you're a bad doctor. I noticed, having worked with doctors who were not native speakers as well, who were like specialists and doing their things and seeing how they interacted with the patients, it really changed my perspective. Because I always thought you have to be perfect, you have to be this, you have to be that. It really doesn't matter. As long as you're a good doctor, you're a kind doctor, patients do not care. You can make errors here and there. Even native Dutch speakers make errors here and there. It doesn't matter as long as you're a good doctor. And I feel like that's why representation matters. That's why more people need to see what you are. If you can see someone living out what you are living out, or what you think you want to live out, that really makes a difference. I'm an advocate for representation. I think representation is really important, because for me, I can already see that every day in my life. Seeing those two doctors, one was German, one was South African, do their thing, make errors, and that had no reaction to the patient interaction for so far as I could judge. That really just gave me that motivation to remind myself it doesn't matter. As long as you try to be the best doctor you can be kind to your patients, be nice to your patients, know your stuff, prepare, it's going to be fine. So I think there's that difference in patients and colleagues interactions. And even further, patients don't really care. Sometimes if you make 1 or 2 errors, you're going to be fine. You'll survive. Third point is the fact that, because I mentioned in the last video that I was happier actually because I had the chance to switch to ITM at some point, but which is the English track in medicine, but I didn't because I wanted to stay in the Dutch track so I could practice my Dutch for longer. Hopefully that would make me more prepared for the clinical rotations. And I guess the question now is, am I still happy with that decision? Do I still maintain the same opinion? And I think the answer is yes. Simply yes. I think just having to have been in a position where I had to practice the Dutch that much and practice it in different scenarios, interact with it, listen to it, take it in, just vibe with the Dutch as much as I could. That really prepared me much better for my clinical rotations. I noticed I was in the hospital a lot more relaxed. I was a lot more reactive. I didn't have to think a lot about words and sentences and stuff like that, because I was already in the thinking pattern of Dutch. I thought in Dutch, I could respond in Dutch snappily. And I noticed when I talked to my colleagues who did ITM, they had a rough start. Some of them picked up really fast, but some of them I spoke to had a rough start, kind of getting used to the flow of it, especially if you're sent to peripheral hospitals where there's a little bit of an accent as well in the Dutch the people there speak. Then of course they're a little bit more difficult to understand and everything, so that could really be challenging for some people. You also had the ITMers who were already Dutch native speakers or who already spoke Dutch but then just did ITM because they wanted to study in English, or they liked the international nature of the program. Those had less problems for so far as I could tell. But those who were never really exposed to Dutch that much, who just had to learn Dutch to study medicine as well, who did the bachelors in ITM, I noticed there were a lot of people who had troubles with fitting in and just, you know, getting the hang of things and being reactive. And for some people it could really be heavy. I don't know of course the depths of it because I had a different experience, but I know now I can say for sure that I'm much happier with my decision to stick to regular Dutch medicine rather than change it to English during the bachelors. So yeah, that's something I just thought I could mention as well. Definitely happier with my choice. I would definitely recommend that to anyone as well who has the ability to do it in Dutch from the beginning, because it just makes your life a lot easier afterwards. And the last thing I would like to definitely talk about, or maybe just give you guys, for those of you who are going to be exposed to medicine in some way, going to do clinical rotations, so thinking about doing medicine, are some tips to help you prepare for maybe that transition to the kooschap at the clinical rotations. The first thing is just to try to expose yourself as much as possible. If you're not a native speaker, try to volunteer. There are a lot of volunteering places around where you can just go there and speak with people for free. Most of the time they are also elderly people, so they can also give you a good representation of what the patient population is like. Make use of that. Expose yourself, talk, watch news, listen to people talk. Try as much as possible to practice as much as you can, because that really makes a difference. In the beginning, it's not going to feel easy, it's not going to feel comfortable, but the more you do it, like everything else, the more your brain gets used to it and the easier it becomes. So definitely practice. And for those of you who are also doing clinical rotations, who are starting clinical rotations and it's maybe proving to be difficult, talk to other people about your experiences. Share your experiences with, I don't know, family members, your best friends. Just talk to them about what you're going through. I noticed getting some of those emotions, some of those heavy things out of your system can really help you. Because sometimes we pile so much that it just becomes heavy, and then the next day you don't know you're giving out at the hospital, you're reacting funnily at the hospital, you're ready to fight, you're constantly on edge because you pile a lot of this stuff up. So talk about the stuff you're going through, talk about your experiences. I noticed the first time I spoke about my experiences to other non-native Dutch speakers, it was cool. It was a whole venting session where you just let stuff out. It was not like we're complaining or anything, but it was just letting stuff out and just laughing about some of the things that happened in the hospital, some of the errors you make, some of the silly jokes, some of the silly mistakes and everything. That is really refreshing. So for sure, definitely talk about it. It helps. So expose yourself as much as you can and talk about your struggles as much as you can. Talk about the good stuff, talk about the struggles as well, because that really helps. I think that's all I had to share. That's my 2 cents on so far what it's been like doing the clinical rotations in Dutch as a non-native speaker. It is going really well, I'm not gonna lie. People are understanding, and it's really cool. But yeah, let me know in the comment section, guys, for those of you who are also doing clinical rotations and are not native Dutch speakers, what are your experiences like? For those of you who are Dutch native speakers, what are your experiences like? Have you had some experiences which you think could be interesting to share? Let me know in the comment section. I always like interacting with you guys. For those of you who are preparing to do medicine, was this helpful? Let me know in the comment section. And if there's something else you want to know, anything you're curious about, be sure to let me know in the comment section, and I'll be sure to talk about that in the comment section or make a separate video about that. But until next time, guys. Oh, my package just came. See y'all. Yes, ordered some books. Why not share? So I got these 2 books. I'm really excited to read them. I'm going on a road trip soon, and I'm going to read this one during the road trip: Vagabonding, an Uncommon Guide to the Art of Long-Term World Travel. But I've watched a lot of reviews about the book, and it has nothing to do with traveling. Of course, it's about traveling, but he talks a lot about other useful life lessons. So I'm excited about this one. And I got this one too, the 80-20 principle, the secret of achieving more with less. This I have heard about for the longest of time. I have applied the principle. I think I've read, I don't know if there's another one called 70-30 principle, but I've definitely applied the principle in a lot of areas in my life, but I've never read the book. So I'm curious what the book is going to be like. I do a lot of reading too. So if you guys actually want to know what books I read, I'm definitely going to make a separate video on books I would definitely recommend. But yeah, this just came in. So I was like, let me share with you guys. So if you want to know more about the books, let me know in the comment section. But yeah, until next time, peace out, guys.